Good evening. I hope everyone is doing well. It's been a few months since I was able to do one of these group visits, so I'm really excited about this one. This one is it's exciting because usually when I'm presenting one of these group visits, it's something that I know well, that I've seen in my patients over and over. Maybe something that I learned years ago from Dr. Ozzie or one of our colleagues. But this one is something that I have just recently stumbled upon a couple of months ago, and it's already made such a big difference in the treatment of my patients. So I'm really looking forward to going through it with you. So let's get started. Okay, so it is food allergies and stress. Is there a connection? So in this group visit, I would love for you to ask questions. And so there's a little Q&A area in which you can post questions. And then at the end of this group visit, then I'll go back through and I'll take a look at those questions and I'll answer them the best I can. So let's get started. So a lot of our patients do show up with symptoms of food allergies. And if you've been a patient of the Maxwell Clinic for any length of time, then you've probably had some food allergy testing, or at the very least put on an elimination diet to see if we can't identify food triggers that could be playing a role in your symptoms. So some of these symptoms that we may see would be tingling and itching in the mouth, hives, itching or eczema, all kinds of skin rashes and issues. Of course, swelling in the face or the tongue, throat, or other parts of the body. A lot of times we think of that as being right after ingestion of the food, but often these symptoms are not immediately after, but can be hours or even days later, depending on the allergic response and the pathway that it goes through. You can also have wheezing, nasal congestion, trouble breathing. People with allergies, they may think they just have seasonal allergies, but often there's a food allergy component to that. Asthma is also associated with some food allergies. Often there'll be abdominal pain, diarrhea, nausea, or vomiting, but also constipation, irritable bowel syndrome, Crohn's disease, ulcerative colitis. All of these can have an allergy component. And then dizziness, lightheadedness, fainting, but I'd also add to that fatigue, which is one that we see a lot, or foggy-headedness or confusion. So once we've identified these symptoms, then the testing is usually pretty straightforward. So we're either going to do testing through blood, or we're going to do testing through skin, or maybe a combination of both. If you go to see an allergist, you're almost always going to have skin allergy testing, which looks like the picture there on the bottom right. And what they do there is they will put a little bit of the food, or a little bit of the proteins from the food, into the skin, just barely, with a very, very small needle prick. And then we wait and we see the reaction that the body has. Normally, this is testing an IgE reaction, or what you would call a true food allergy. There are actually a lot of steps between the antibody IgE and the actual histamine release that causes these whelps to form. And so anywhere along that pathway, you can have either disruption or amplification. So that's the way you test in skin. And then over there on the other picture in the top left, what you see here is a screenshot from one of our food allergy tests. And we're looking here at 4 different ways in which the immune system, your immune system, responds to foods. So you can see there, this top one here, you're looking at is almond. So you can see that there's an elevated amount of IgE, which is the antibody we think of associated with true food allergies. And then you see this column IgG4. And IgG4 is kind of like a bulletproof vest. So let's say that you eat almonds all the time and your body is allergic to almonds. Well, if I continue to eat them, then I'm going to try and protect myself. It's this beautiful way in which the immune system helps to protect us. And so it will create IgG4, which is like a bulletproof vest to protect us against the reactions that can occur because of the IgE. And then we see IgG. So IgG we think of as a sensitivity. And these are the same types of antibodies that we make against viruses or against bacteria. We hear a lot about IgG right now, especially in the pandemic because of COVID, right? So everybody's talking about COVID antibodies. And for the most part, they're talking about specifically IgG antibodies. So this is the body's response to disease. It's interesting to think that our body would respond to food in the same way that it would respond to disease, right? What would cause that? Well, one of the things that causes that is when these large proteins from these foods leak across the small intestine into the bloodstream where they don't belong and they haven't been designed to be received that way. We call that leaky gut. And then those proteins, the body, the immune system recognizes as foreign, it attacks them, and then creates IgG. And then we have that last column there, C3d, or what we call complement. This is 100 to 1,000 times multiplier. So sometimes I'll explain it like this. Let's say that you have a forest worker who is going through the woods and she finds a tree that doesn't belong there. She paints a big X on it. That's the job of IgE, to recognize that something does not belong here, right? It needs to be gotten rid of. Then you have another forest worker. This is complement. And they come through the forest and are looking for those X's. And they find those X's on the tree, and then they put 1,000 pounds of dynamite around the base of that tree, and they blow it up, creating a huge explosion, right? This is a lot of inflammation. And that's what complement does. So remember, it multiplies the reaction 100 to 1,000 times. It's pretty significant. So with these two tests, whether through blood or through skin, we're able to determine which foods that your body reacts to, whether it be allergies or a sensitivity. So from there, this is where it gets interesting. So a few months ago, I started noticing some observations, things that made me wonder if there was something going on here with allergies that was maybe a little deeper than just a skin test or a blood test that shows you have an allergy and then therefore you should remove the food. So some of those observations are tourists. So you may have heard this yourself. You may have heard that sometimes people will say, you know, they're gluten sensitive or maybe even celiac, which means allergic to gluten. And they'll say that when they go to Italy, they don't have any problems at all, right? Or when they go to other parts of the world. And often the reason that would be given why they don't experience these reactions in foreign countries, but they do experience them here back home in the United States, is that there's a difference in the wheat, right? The difference being that there are more heirloom varieties over in Europe, and they use less chemicals, less hybridization of the products, less processing of the products. And those are all true. Those are true. And for a long time, that's what I went with. Like, wouldn't it just be great if we could live, you know, in Europe and just eat gluten to our heart's content? But, you know, you can buy a lot of those products that are made in Italy, made in France, with these heirloom products, or even products made here in the States that are made with heirloom wheat or organic wheat. These are wheats that have never been around these chemicals or haven't been hybridized, and you still have that reaction. So it made me wonder if there's something else going on. And then I had reflected on a vacation that I had had. And it made me remember that, you know what else is different when we go on vacation? We have less stress, right? Usually when we're on vacation, the day-to-day task lists and worries and things that make us frustrated or bring us anxiety, they don't exist, or they exist in a different way. And that would that would change our neurotransmitters, that would change the way that our nervous system interacts with our immune system. So I thought about that, and then I also seen and have seen in my own practice that there have been significantly more food allergies in our own patients and in America since the pandemic. Now, that I know of, there's not been a lot of change in wheat or in food processing in the last couple of years, but there has been a significant amount of stress. Stress has gone up. So you see this where stress has gone up, also food allergies have gone up. Now, just because you have correlation doesn't mean that you have causation, right? So just because stress has gone up and food allergies go up does not necessarily mean that stress caused that. But it does make me want to dig a little deeper. So recognizing that, I also thought about a lot of medical providers, friends that I know, even famous functional medicine doctors that we hear about all the time, who talk about how their food allergies or their autoimmune diseases didn't really show themselves until medical school. And for a lot of medical providers, that was the place where they started to explore natural health or different ways of healing when conventional medicine didn't seem to fix the problem. You know what's interesting about that is medical school, PA school, nurse practitioner school, like these things are very difficult and they're very high stress situations. And so it made me wonder, does going through these stressful schools increase our immune response and thereby increase allergies and food allergies? So then I made another connection. I see a lot of children in my practice, which is such a blessing to be able to help young children who are going through chronic diseases or chronic inflammation and help reverse that when they're young so that it doesn't become a lifelong battle. And one of the things that I began to notice is that when I treat children for allergies or eczema or asthma, there seems to be a correlation with parental anxiety or parental worry. And I mean, that could be easy to explain away, right? I mean, it would be easy to say that if you have a chronically ill child or a child that has asthma, which is very dangerous, very life-threatening, then of course that's going to bring a lot of anxiety and that's why they're anxious. But I looked into it a little bit and it's interesting what the studies show. And I'll talk about that in the next slide. And then the straw that broke the camel's back was I had a friend of mine send me a YouTube video that talked about this, this patient's journey through topical steroid withdrawal. If you haven't heard of this before, it's where you've been using steroids for a really long time, topical steroids, maybe for eczema, and now you have this almost need to use these topical steroids, or else the skin will almost automatically flare. What was interesting in these individuals who have topical steroid withdrawal is that they also have very, very high levels of IgE. IgE is the antibody, remember from the test before, it's the antibody that is associated with allergies. And when I say really high, I mean really high. So somebody without allergies might have an IgE of less than 20, and I'm talking about an IgE of over 1,000. So very significantly elevated. So with that information, I began to wonder, you know, what else causes people to have high levels of cortisol? Is stress. So what I wondered was, do people who have a lot of stress, who have chronically elevated cortisol because of their anxiety and because of the stress that they've had in life, do they also have elevated IgE? And they do. They do. So anxiety and stress is associated with elevated IgE and also elevated allergy and elevated skin disease and eczema. So then I began to look at the data, right? Because just because you see things correlate doesn't mean they're caused by one another. So it's important to see the studies that have been done. And so I came across this study that looked at college students, and it looked at their perceived stress associated with studying for a test and then taking the test. And then after the test, watching what happens to their stress level, but also looking at what happens to their antibodies. These were not just IgE antibodies, the ones associated with allergy, but they also looked at IgM, which is associated with acutely ill patients, and also IgG, which, remember, we talked about those as food sensitivities. That's also associated with leaky gut, also associated with having the disease, having gotten rid of the disease, and now being prepared to deal with that disease if it comes back. So what the study showed was that right before the test, the students' antibodies were elevated, and they were correlated with their perceived stress score. Wow, this is fascinating information, right? It seems to show that there is a direct correlation. And then after the test, you would watch perceived stress decline, and you would also see these antibodies decline. So that was one study that was helpful. So then I looked at the data to see if there had ever been studies done in anxiety or perceived stress in pregnancy and elevated IgE antibodies in babies. And what we've seen is that there is a correlation. So moms who have a stressful pregnancy also tend to have children who are more likely to have eczema or more likely to have allergies. And that's just, I mean, that's amazing because we see stress levels going up in our community, and we also see food allergies going up in our children. So this gives us a new way to be able to attack this. If we can help bring down stress in our pregnant population, then we can decrease allergies in children. Really exciting, especially when you consider how dangerous some of these allergies are, like peanut allergies or like gluten allergies. Then there was another study that looked at caregiver stress perception. So these are young children, these are young parents who are caring for their children after birth, and this study tracked until 2 years. And it looked at the perceived stress of being a caregiver for a baby and for a toddler, and how that was associated with IgE expression in the child. So this is even after birth. So the child just being around a parent who felt stress increased their IgE expression or their allergy, their eczema. Then there was perceived stress. So perceived stress, let's talk about that for a second. So perceived stress is really interesting because it's not objective, right? Perceived stress is how I feel about my stress, right? So if I lift 100 pounds and then one of my coworkers lifts 100 pounds, then that is objectively 100 pounds that was lifted. But if I say I feel like that was 100 pounds and my neighbor says I feel like that was 100 pounds, that doesn't really mean that we both lifted 100 pounds, right? Our perception doesn't always match with the objective truth of the weight. So perceived stress works much the same way. I may feel like what I'm going through is really, really stressful. And someone else may go through the exact same thing, but not feel as if it's stressful. See, this is the difference between perceived stress. But what is interesting is that the brain is most worried about perceived stress. So if I think that what I'm going through is highly stressful, then the neurotransmitters of anxiety are released in my brain, flood throughout my body, and a cascade is set off that could eventually lead to allergies, as we've talked about in these prior studies. So you have this immune response based on perceived stress. And it's mediated in the middle there by the neurotransmitter activation. So the neurotransmitters in my brain that make me, that are released when I perceive stress. So then I wanted to look and see, like, well, what can we do about this, or what has been done about this? So if you look at yoga, there was a study done with yoga and cytokines. So cytokines are these drivers of antibody separation. So when we talk about antibodies, we're talking about the IgE, like we showed on that test before, the IgG. So cytokines are what forces the body to make these things, to force the body to become more sensitive, or to become more allergic, or to be able to respond to something as if it were an allergy. What was so cool is that the people that practiced yoga often, they had lower cytokines. They had lower drivers of inflammation. This doesn't say anything about whether or not they were eating gluten or not eating gluten, or eating dairy or not eating dairy, or or whatever food allergy. It has nothing to do with the actual food allergies. It has nothing to do with seasonal allergies. It had a lot to do with just practicing yoga. And we already know that yoga objectively decreases stress. And then there was another study I seen that looked at guided imagery. So guided imagery would be if we close our eyes and we focus on this, this green pasture. We can see the wind just gently blowing through the grass. Maybe there's a creek beside this pasture, and we can hear the water rumbling over the rocks ever so gently. It's a nice, cool temperature of about 65 to 70 degrees. And we just sit in that space. So that's guided imagery, which leads to relaxation. You actually see this in a lot of faith traditions. So in Christianity, there is a version of this called Lectio Divina that goes back thousands of years, way before modern medicine ever discovered mindfulness. And it would take a scripture, and it would find a piece of scripture that really settled the soul. I mean, maybe in Psalm 23, it was this idea of being comforted by a caring and loving shepherd. And then you would just sit in that space of knowing it logically, what the word said, what the picture looks like, and feeling it in your heart, what it feels like to be held, to be loved in that space. Those kinds of things actually reduce serum IgE. They lower the body's ability to respond with an allergic reaction. In this specific study, it was asthma, but it could just as very well have been eczema or food allergies. I think that these studies, and these aren't necessarily new. I think the newest one was the guided imagery study that was a couple of years ago. A lot of these studies were done back in the early 2000s. But you see, it just takes a while for medicine to catch up to the studies. Okay, so now that we have found a connection between stress and allergies, now I want to review a functional treatment of allergies and what we typically do. So typically what we want to do is we want to stop the spiral. So allergies and inflammation are this cyclical rhythm that just keeps getting worse and worse and worse. So in order to stop this spiral, we need to remove the food or remove the offending agent. So if you go see an allergist, one of the things that they're going to do if you have seasonal allergies, they're going to say, okay, let's seal up the windows. Let's make sure we don't open those. Let's make sure we have a top quality air filter in the house. And we want to decrease our time outside, or we want to wear a mask, and we want to make sure we have no pets. Right? This is isolation from the offending agent or from the allergy. Or if it's a food, we say, well, then you just can't eat that anymore. If you're allergic to gluten, then you just don't ever get to eat gluten again. Or you have to be really careful not to get very much of it. Or it could be dairy, or it could be almonds. I mean, it could be any number of foods. So then another way that we can treat food allergies is nutraceuticals that lower the response. So this is going to be something like milk thistle. Milk thistle is good in allergies. There's also quercetin. Quercetin you have heard a lot about with COVID recently, and it lowers inflammation, but it specifically interrupts that pathway that starts with IgE and ends with histamine. So you can use nutrients that lower the response. Or you can do allergy shots or drops. So remember we talked about that IgG4 and how I said it was like a bulletproof vest? That's what allergy shots or allergy drops, that's what its focus is. So if I'm allergic to almonds, and then I take a almond allergy shot, or I take allergy or almond allergy drops under my tongue, then I'm going to build IgG4, which would then protect me against that IgE reaction. That's not something I do a lot with food necessarily. If it's a seasonal allergy, then I think that makes a lot of sense, right? Because I can't get away from nature. And actually, we don't really want to, right? We want to be able to be in nature. So allergy shots or allergy drops for environmental allergies makes a lot of sense. But when it comes to certain food allergies, we don't really want to decrease that allergy to gluten by adding another immune response, by adding IgG4, because that's just another immune reaction. So now we've got one, and then we've got another one to cover it. So if we can, we want to stop the allergy completely or stay away from the food rather than just trying to cover over it with a second immune response. So we also treat functionally, we treat allergies with things like omega-3s or vitamin D, which are shown to lower the inflammation. If we lower inflammation in the body, then we tend to lower the allergic response. So what if we add stress reduction to lower allergy expression? See, in that way, this is what's so exciting, because we're always seeking to treat people as holistically as possible. And so by using stress treatment to work on allergies, we're adding another facet, and we're truly helping this to become a holistic way of treating allergies. So now let's take a look at functional treatment of stress. So functional treatment of stress usually goes something like this. This plate that we're always talking about? We have this plate that's just too full. We're usually talking about our life. We're usually talking about all of the things that we have on our plate. So I can either increase the size of that plate, and I can do that by decreasing inflammation. I can do that through meditation. I can do that through a whole lot of different ways in which we're able to become more resilient to stress. That's the key word in increasing the size of your plate, is resiliency. Or we can decrease what's on the plate. So this is like prioritizing, right? Thinking about in your life, what is truly your responsibility, and what can you maybe give authority to other people to, so that they can do the tasks and that you don't have to, or what things can just fall aside because they're not even necessary. So you're decreasing what's on your plate. The other way that we can treat stress functionally is neuroplasticity. So this is neurofeedback. This is biofeedback. This is any different way that we can use to change the neuronal pathways that trigger our body into a stress response. This can also be done with therapy. You could use narrative therapy to help repair some of the broken parts of your story and help to start reframing maybe how past events and past harm have caused you to show up in the world a certain way, maybe stressed out, maybe anxious. So you can attack stress that way through narrative therapy. You can also do it through things like EMDR or brain spotting. There's also different types of prayer. A manual prayer is one of those that actually helps to change the way the brain works. And then there's nutraceuticals. So sometimes there are deficiencies of nutrients that cause increased anxiety. So that would be things like omega-3, vitamin D, could be magnesium. All three of those things have been shown in research to decrease anxiety, especially if there is a deficiency there. Or it could be through nutraceuticals using something called green medicine. Green medicine is where you use an herb or a supplement or a nutrient in a similar way that you would use an actual medication or an actual drug. This would be like maybe using kava root for anxiety instead of using Xanax. So that's also a way. There's all kinds of herbs out there that you can use to help treat stress. So we want to disrupt the allergy pathway when we treat stress. So that's amazing that we can do that, right? And that we can think of the food allergies that we have as being not caused necessarily, but definitely being amplified by the stress that we have in our life. And I think that there is tons of anecdotal evidence. As we even have walked through this group visit, there may be even examples in your own life or maybe in friends or family that you have where you're like, oh, I can see how this happens. And I would encourage you that if you feel like this is what's going on with you, then talk to your healthcare provider about it and start thinking about how stress could be playing a role in your allergies. A lot of times when we have patients in functional medicine, they're used to being treated in a conventional model. So they may come to us and they understand that we're going to use deeper testing, or that we're going to maybe use natural ways of healing, or we're going to use supplements or food plans. But they may think it's kind of crazy if we want to talk about your stress level when you're worried about your food allergies, right? But hopefully that this group visit has shown you that there's actually a pretty significant connection. And I think that it's not just with stress and allergies, but it's also stress and chronic disease, which is clear in the literature. It's stress and just about anything. I mean, if you look at the blue zones, which if you know me, I'm always talking about these areas around the world where people tend to live the longest and be the healthiest. Stress is the main reason that most of these populations tend to live longer, because they have a decreased stress as compared to most of Western culture. So thank you for taking time with me this evening and letting me share with you these ideas on stress and allergies. Are there any questions? All right, I don't see any questions. Let's see, let me look at my notes and see if there was anything I wanted to add to that. No, I don't think so. I think that's it. Well, I hope everybody has a wonderful evening. And of course, if you think of any questions later, please reach out to us. That's what the portal is for. And have a good night.